This is our Restorative Medical RestAir Knee. It comes in adult sizes. It's not available in pediatric version. It has 2 air bladders securely sewn into chambers at the back of the knee. And you can see how they're shaped when you start to inflate those. Inside they will actually take on the shape of the patient's knee. The label is at the top like our other hinge devices. This label will be in the front at the top of the patient's thigh. It comes with, of course, a hand bulb pump to pump up the air bladders and a hinge on each side. Now these are metal hinges, but because of the construction, the way it's designed and with the air bladders, it still provides that flex technology plus that will reduce tone and spasticity, be comfortable, but it also provides the prolonged low-load passive stretch to prepare the muscles to be re-lengthened. That prolonged low-load passive stretch over a period of time, and literature says about 6 weeks, to realign the actin and myosin proteins in sarcomere units in the belly of the muscle. This has to be done before we can begin to re-lengthen muscle. We have to go through this process, and that's very important. If we try to just aggressively stretch these people toward normal, we run the risk of tearing muscle away from tendon away from bone, causing needless pain. With our neurological patients, it's not that hard to overstretch too far too fast, kick in the stretch reflex, and then they rebound back even worse. So it's totally different from orthopedic, and the splints and stretching measures we use are totally different. If you have a really severe, maybe knees in the buttocks type of knee flexion contracture where the knees are totally bent, then you may want to take the hinge out to begin with and just use the material, the bulk of the material behind the knee to start to loosen it up. We know that movement is what lubricates the joint. It takes that movement for the bursa to create synovial fluid, which is the grease or the oil of that joint. So if they've held their knee, in this example, any joint, still for too long, then it's dried out. So we need to start just that movement to get them starting to be lubricated, because it will again produce synovial fluid. We do want to remember, with this much material and these air bladders at the back of the knee, it's going to prevent, even though this is very air permeable material and there's foam, you're going to restrict some of the airflow to the back of the knee. So if they have an issue, an open wound, or some condition that they need good airflow to the back of that knee, maybe severe sweating, then you would want to look at the flex knee, the NeuroFlex restorative flex knee versus this one. They're designed for different scenarios. Different therapists and nurses and orthotists like different ones. So we want you to have the tools that you desire to take care of your patients. These hinges are very simple to set at flexion and extension. You simply pop out the little pin and it goes back in. They're attached with little loops so they won't fall out, and you snap it into place. You bend the device and put them back in. They just slide into those slots. Then this goes down not just to protect the other leg from pressure, but also it holds the hinge where it needs to be. These are very simple to fit. You undo each strap, cuff strap. You want to always put the Velcro back on the strap. And then that Velcros, this Velcros, and you have 4 straps over your kneecap. when you initially fit the kneecap, you're going to work all 4 straps, and then after that all you should have to do are the ones outside. Now these come in right and left. This would be a right because all your Velcros go in this way. You want your straps to go to the outside of the knee, not try to bring them on the inside where they might rub the other knee. And it's just hard when you have real contracted patients to get straps between the legs. So let's put them to the outside. Just makes it a little easier. So this is how simple it is. You're going to just slide this under your patient's knee, bring it up. Let's attach this and this. And you'll figure out your own way of what you feel like is easiest to put it on. But for the initial fitting, again, we're going to work all 4 straps to get this centered. And you want to suck that knee, suck your leg right down into the device. You're not going to overstretch it, but you want this to fit them snug enough in extension to where the splint has a chance to do the flex technology. But you're not going to overstretch the knee. You set the dials where they need to be, and then you make the splint fit the patient. Then you attach these straps. You always want to consider the length on your hinge excuse me, devices, elbows and knees. Same type of joint, same design of splint. But the length is vital to have the appropriate leverage to be able to create extension from flexion. If it's too short, you run the risk of having pressure on elbows or knees, either one. And it's just not as efficient at correcting if you don't have the length, because that gives you the leverage to safely move them and allow them to move within the device. These do come in sizes. Now we're going to inflate the air bladders. Pull out the tip. And we want to hold the end of the tip secure that's in the black. If not, we run the risk of this loosening, and if you break that seal, it may leak, and we're happy to replace those, but you'll have very, very good luck with them if you just follow these instructions. Now here's the hand bulb that comes with it. You can, if you forget which one pumps, you can do this and feel the airflow. It's the clear one. Insert it and begin to pump. Now again, this is not orthopedic. You don't have to worry about how many you pump. You can count them if you want, but it really isn't necessary. You're just going to watch and see how much they're elevated. You're going to tuck these back in. And what this does is just add a little more bulk behind the knee. As you can see, the shape, it takes on the shape of the knee. It's going to surround it, so you can't have any pressure. Any pressure would be, potential pressure would be dispersed over the entire length of the air bladder. So you've increased the bulk behind the knee, you've increased the extension. That, working with the hinged sidebars, do a very good job of working through tone and spasticity and helping to re-lengthen your knee. If you can't get the knee totally to correction with this splint, but you needed it to begin with because the contracture was so terribly severe, then the next graduation to complete that correction would be on to the flex knee. This is a wonderful product for those really, really severe patients, and it is the Restorative Medical RestAir Knee.